The ultrasound examination of the hip involves a series of scans in order to evaluate the structures of the anterior compartment, the lateral compartment, the medial compartment, and finally the posterior compartment. We shall start with the study of the anterior compartment, and we mainly perform axial scans of the hip. The main point of reference to start the front compartment scan is the anterior superior iliac spine. Here we can see it very well. This is important because two components are anchored at this level. On the lateral side, the tensor fascia lata, and medially, the sartorius muscle. After having determined the ultrasound anatomy of these structures, we move the transducer distally to recognize, more in depth, the anterior upper iliac spine. This is very important because it hosts the insertion of the rectus femoris. The insertion is unique, and the tendon complex of this muscle is very peculiar. I will show you now how to scan the muscle on the short axis and evaluate it within its intimate structure. With this scan, we see perfectly the muscle belly of the rectus femoris muscle, within which we notice a small structure that starts, in this case more superficially, and almost looks like a comma. And it is precisely the indirect tendon. This tendon starts in the rectus femoris muscle before merging, more proximally, with the direct tendon, which in turn fits directly at the level of the anterior superior iliac spine. There is also another tendon, called reflex tendon, that fits in the hip at the acetabular edge. From the ultrasound standpoint, this structure is very important, and it can also be viewed by orienting the transducer on the long axis to better display the tendon component of the indirect nerve in the context of the muscle, which then joins with the direct tendon into the anterior superior iliac spine. We now move medially to view the vascular femoral nerve bundle, which you can see in this region, and we highlight a very important structure, the psoas muscle. The structure, as you can see, has an oval shape, and it is a psoas. And more medially, there is a tendon that we follow to its insertion into the lesser trochanter. We have now examined the most important components in the anterior compartment of the thigh. We now move medially to study the adductor muscles and their tendon insertions. We have to place the leg in this position, and we will perform scans both on the short axis and the long axis. Our reference point is obviously the pubic region. We begin with a scan on the long axis. This allows us to examine in great detail the three components of the adductor muscles: the superficial component, that is the adductor longus, the intermediate component, which is the adductor brevis, and finally the deeper component, which is the adductor magnus. These three components have actually a single tendinous aponeurosis, which inserts, as we can see this very well, in the bone of the symphysis pubis. This is the common insertion of the adductors, and these are the muscle bellies. We can now turn the probe in the short axis and analyze the whole course until we reach the region of the actual muscle bellies. We now move to analyze the side components of the hip. We therefore ask the patient to turn to the left, because in this case we're going to evaluate the tendinous components of the gluteus that insert, as you know, at the height of the great trochanter. The first scan, as always when examining the tendons, is on the short axis. We start proximally from this region to assess the muscle components, and then we move on the point of insertion, and we can see from the front to the back the gluteus insertions. More specifically, we find the gluteus minimus in the front, the medius gluteus, and in the rear, the gluteus maximus. It is important to perform scans along the major axis too, because rotating in this way the transducer by 90 degrees, it is possible to evaluate the tendon insertions along the major axis. This type of insertion appear to be almost like the shoulder rotator cuff and probably have a similar type of behavior. Above these structures, we can finally recognize the fascia lata tensor that covers them. Finally, we close the examination with the analysis of a very important muscle tendon system, the hamstrings or thigh flexors. We ask the patient to lie on his stomach, and, in order to see these muscles properly, we begin the scan from the gluteal region. We have to apply a little pressure because the tendons of these muscles are inserted on the large ischial tuberosity. We recognize this very well, and we can see the combined insertion of these muscles. I remember that the hamstring muscles are, starting from the outer region, the biceps femoris, the semitendinosus and the semimembranosus, which share the common insertion. We will try to go down and consider the muscle tendinous and muscle component of these structures. I would like to remind you again that, starting from the outside, in order, we find the biceps femoris, the semitendine, and finally the semimembranosus muscle. The last scan that we will perform, and it is of major importance, is dedicated to the coxofemoral joint. We ask the patient to lie on his back again. We place the probe, as we did in the initial scan, for the study of the tendons of the anterior compartment of the thigh, and we focus on the deeper part of this joint. This scan allows us to evaluate the most anterior bone components with specific reference to the anterior surface of the femoral head, the front profile of the acetabulum, and the joint capsule, which, in this case, is dominated by the psoas muscle. This scan is very important because it is very often used to perform interventional procedures, such as endoarticular injections of hyaluronic acid. At this point, the test can be considered complete. Thank you for your attention.